everyone, and welcome to the Southern Medical Association Physicians in Training podcast. My name is Ben Loftis, and I am a current medical student at the University of South Alabama. Today, I am joined by Dr. Robert Israel. He is a doctor of internal medicine and a fellow of the American College of Physicians. Thank you so much for coming to speak with us today, Dr. Israel.
Sure, glad to.
All right. Well, I guess to kick things off, if you could just tell us a little bit about yourself and maybe how you got involved with nutrition.
Well, that's a very good question. I learned almost nothing about nutrition in medical school. And after I'd been in practice for a few years, I realized how little I actually knew. And I also realized that I wasn't really succeeding in my goals of making patients healthier, particularly in type 2 diabetics who I was giving more and more medication to and having less and less success controlling their blood sugars and their A1Cs. And I kept seeing people develop more and more chronic disease that appeared to me to not be necessary, but I wasn't really succeeding at helping them prevent it. And about that same time, I came across a Harvard CME course that was in Napa, California, which I thought that can't be too bad. So I sort of read about it, and it was all about healthy cooking that tastes good. So it was at the Culinary Institute of America. I ended up going, and it was really life-changing for me. The professors from Harvard, the MDs, talked about diabetes, coronary disease, hypertension, etc. And then a chef would take you in the kitchen and cook a meal based on what the lecture had been about. And all the food was just spectacular. And I thought, my God, no wonder my patients won't eat what I tell them to eat, that they would eat this. So I came back and started telling people that healthy food didn't have to be bad tasting. And in fact, the only way I'd ask them to eat it is if it was delicious. And then over time, I ended up with the teaching kitchen, and that's how I got to where I am now.
All right. That's super cool. I know I've always thought it was crazy how little nutritional education we get in medical school. And so I think that's really cool that you were able to do that CME course. I guess I want to ask just for those that don't know, I have been lucky enough to attend a few of your teaching kitchens or through the school or things like that. But I guess for the people listening, if you could explain just kind of what is a teaching kitchen and also some of the interesting ways that you've been able to use it and incorporate it into your medical practice.
So a teaching kitchen can be, there are a lot of different iterations of teaching kitchens. Some are as simple as a little hot plate on a desk in a medical office. Some are, I mean, major fancy. I went to one in Cleveland at Case Western Medical School that's set up with, gosh, probably a dozen different actual full kitchens where you can bake, cook on a cooktop, have a sink, etc. So they have 48 students at a time in there. The one I work in has a single 6-burner cooktop and 2 ovens, sort of almost like a typical home kitchen, but with room enough to teach 12 students at a time. The way I've approached most classes is that I break people into teams of 2 to 3 to sometimes 4, and have them prepare a different dish with each team. And all the dishes are meant to be both healthy, relatively easy, teach something about kitchen skills and cooking skills, and taste good. So we don't always necessarily prepare a group of dishes that fit together as a meal. We might, for example, have several carbs. If we're talking about carbs, we might have several different carbs in different ways, and pasta, rice, whole grain rice, or farro, or other whole grains, for example, if we're talking about carbs. On the other hand, if we were doing a meal, we'd have just one carb and some vegetables and maybe another protein source. So anyway, we cook several different things, and it's always fun because a lot of times I try to do something that people hadn't done before, and we'll have, for example, cauliflower roasted in the oven, and we usually have at least 2 or 3 people who've never eaten cauliflower, or we'll have celery root or some unusual vegetable that people are intimidated by. I mean, when I first started cooking, pretty much the only thing I knew how to do was grill a hamburger. But now I can cook other things. So,
Oh, you're being
back when I,
humble. You're being humble. I saw you in the kitchen.
well, it takes a while to develop those skills. You know, one of the Harvard professors at that first course said that he realized the same thing that I'd kind of realized. He was an internist as well. He said, one day I realized that if I was telling people to go home and cook healthy food, but they didn't even know how to hold a knife and cut a tomato. And that was
Mm.
true of me. I mean, I didn't know how to cut a tomato before somebody taught me how. And so you need some of those skills to be able to cook meals. And then you need some ideas. We find a lot of the things that stop people from cooking healthy meals is they may not have time, or think they don't have time. They think that's expensive, which it can be, but it also can be very budget friendly. Or they don't have an idea of what to cook, what the meal might look like. So we try to approach that as well. And for example, we tell people probably the cheapest protein on earth is beans, and beans are loaded with protein and cost $1 for a pound. I mean, it's kind of hard to beat.
Absolutely. I know. I think the Calm Nutrition group here did some cool classes where they walked through Dollar General and were able to kind of pick out and show people these are some cheap options. Like healthy eating it's doable on a budget, and so I think that's
Yes.
cool. Um, well, okay. I guess I just wanted to ask, what are some of the difficulties that you faced trying to use a teaching kitchen? Because I know I mean, there's a lot of work that goes into it, and I think it kind of takes a lot more than you would think to get a whole
Yeah,
class.
probably the most surprising thing for me is how much time it takes to prepare for a class, because you got to get all, all the ingredients and make sure you've got everything. One of my nightmares is that I'm going to not have something that's crucial to the dish. But it probably takes about twice as much time to prepare and clean up as it does to actually teach a class. So an hour and a half class takes maybe 3 hours of prep time and cleanup time afterwards. We don't have the budget currently to have enough help to make that piece shorter, but I'm getting better at it and learning ways to cut corners so that at first it probably took me even twice that much longer to prepare and clean up after class. So that's getting easier. Some places have dietitians and other helpers who do all that part, and so it's a much shorter period of time. The the barriers for patients, or for all of us actually, like I said, are either time related, budget related, or just idea related. As to,
Mhm.
gosh, I'm overwhelmed by the idea of trying to come up with another set of dishes for supper tonight. On the other hand, I like to eat so much and I like to cook so much that I have dreams of meals. So my problem is I don't have. It's not that I have too few ideas; it's that I have too many ideas. So I've got 13 dishes in my mind and only 3 places on my plate that I need to fill.
Hey,
But
but
I'll go through the grocery store. I'll go through the grocery store and see a vegetable and think, "Oh my God, look at that vegetable! That deserves some treatment that'll make it look great on my plate."
absolutely. I
Same
think
way with
that's
cooked fish.
I think that's one of the good things about a teaching kitchen though, because like you were saying, a person before they really know how to cook looks at a vegetable in a grocery store and they don't have any idea of what to do with it or what it would taste like with anything. And so I think that that's like a really good benefit of them is just teaching people to kind of go upon their own initiative and make their own recipes and kind of modify stuff. So I think that's really cool. Um,
One of the other things I really like about teaching here in Mobile, uh, Alabama's, as usual, leads the country in weight and
mhm,
unhealthy habits, etc. But uh, a Southern diet can be a really healthy diet. And
mhm,
so I love showing people that, hey, we can have red beans and rice and it'd be really good. We can make a few substitutions, but they actually are flavorful substitutions, like maybe whole grain barley instead of white rice, or whole grain rice, or wheat berries or farro or something in the place of the rice. And they're surprised because they like it. And that's really fun to see people enjoy something that they don't trust your what you tell them, but then they taste it and they believe.
Oh, absolutely. I mean, I was surprised. Like your the chicken wing cauliflower that we made. Every
Mm-hmm.
single time I've done a class with you, I think I've left, gone to the grocery store and bought stuff. It bought a new
Good.
ingredient that I've never used before, and that's been one of the
That's
most
what we want.
things about it. It's been really cool. I guess the next thing I'll ask is what advice you could give to patients that maybe don't have access to a teaching kitchen or are looking for new recipes, because you said that's half the battle, I think, is having ideas for what to do with food. If you don't
Yeah.
have a teaching kitchen, where do you go for information?
There's we're members of the Teaching Kitchen Collaborative, which is a group of about 65 maybe academic medical centers and other health centers that have teaching kitchens. The website is the Teaching Kitchen Collaborative, and there are now almost 100 recipes on that website that are all relatively simple, all relatively good tasting. I hadn't cooked all of them myself yet, but every one of them I've cooked has been really good. Uh, Budget friendly. The ingredients are relatively easy to find in almost any grocery store. And there are a few videos on that website as well. So that's a great place to go find recipes. And then another good site is the New York Times cooking website. That requires a subscription, but you can actually get free emails from them that recommend as many as 5 recipes a week that don't cost anything. And they're not all that at that website. They're not all healthy, but a lot of them are. And you can kind of begin to tell once you learn that things like olive oil is the best fat for most people. Uh, Whole grain instead of processed grains are good for you, and lots of green vegetables are good for you. Lots of fruit and less meat. Once you learn just those basic things, you can make some substitutions in a recipe. For example, red beans and rice, instead of white rice, go with whole grain or something else in its place. And instead of a white pasta, go with a high protein, high fiber pasta that tastes good. And you can kind of learn those things on the way. Uh, the Teaching Kitchen Collaborative is going to keep expanding that recipe
Hmm.
portal, and it's going to be available to anyone free of charge.
Oh wow, that
So
was gonna be the next
that's
question.
probably the best. Yeah, yeah.
I was gonna ask if anybody could access that, or that's very cool. Um, I think the next thing I want to ask you is that I think other either residents or physicians would be interested to say is how do you talk to patients and get them to like do you have a strategy to get the patients to understand the importance of changing their diet and how do you get somebody to start making those changes?
Um, I I think now I've learned, at least for me and for most patients, it's easier for people to make little steps. So I I try to take a food history, a diet history, and sort of see what people do throughout the day, what they have for breakfast, where they eat breakfast, if they eat breakfast, what they have for lunch and where they eat it, and then what they have for dinner and where they eat that, and what their snacks are and when they snack. Are they eating right before they go to bed at night? And then it depends on that history a little bit what I'll choose to see if they're willing to change. So, and that's a big part of the thing too, is you have to assess where they are and what they're willing to do. Maybe breakfast is a good opportunity. So if they're eating breakfast in a gas station every morning, and the breakfast consists of a 32-ounce soda and chicken biscuits and a sweet maybe, that's some really low hanging fruit. If they're willing to give that up, then maybe offer them a whole grain muffin made at home with peanut butter on it or something, if they're willing to do that. On the other hand, maybe lunch is the place they're willing to make a difference, or even snacks at bedtime, or wherever they're willing to try. That's where I go first and give them some suggestions of what they might do that's healthy. Uh, and then once they've done that and had success, it's a lot easier to start to make other changes. And it's phenomenal how much difference one little change can make. I mean, people start losing weight, they feel better, uh, and success breeds success. So if they're willing to, and you know, sometimes it's not food that I start with. Sometimes it's movement. So I'll try to get people to start walking or getting a little bit of exercise. And then if they do that, their appetite or their food choices begin to change as well. So anything I can do to sort of begin to change their lifestyle, maybe stress management, maybe it's stopping cigarettes. You know, every one of those things makes a difference, and it is overwhelming to try to do all of them at once. So you kind of have to find the best approach.
Yes, sir. Absolutely. I think that was really great advice. And I think is another advantage of kind of the teaching kitchen. It's a little bit of a long term, like you kind of can teach yourself to make small changes over time. So I think that's really cool. Um, well, I think the next question I want to ask, just kind of bouncing off of that, is just some further advice that you think you could give to other physicians or other residents on how they can incorporate nutritional teaching into their practice. Because obviously, I'm not practicing yet, I'm just a student. But I can imagine it can be kind of hard to
It's
incorporate
difficult.
that practice.
I think there's no question in my mind that if you take just a little bit of time on every visit with patients to talk about lifestyle changes, see where they are in their lifestyle, and then what might be something you can change. That's the first step. And if I'll tell you a funny story.
Mhm.
One of my patients with diabetes and weight problems uh, went to his ophthalmologist to get retinal evaluation.
Hmm.
And the ophthalmologist started out asking him if he was exercising and if he was eating vegetables and same things I typically say. And the patient said, "Doctor, you've been talking to that Dr. Israel." And I said, and he came back and he had incorporated a lot of those changes, and probably the ophthalmologist made a bigger difference than I did. So the two of us saying the same thing really did make a
Hmm.
difference. But I don't. In fact, I guess I've forgotten what your question was, but I think that's getting just a minute out of a 15-minute visit on one topic of lifestyle is, if we all did that, we'd see a huge difference in outcomes. Then if you want to incorporate actual teaching cooking skills, you can have just a hot plate and have a group of 6 patients in a room with a table and cook some vegetables or saute some beans or that kind of thing. And you can actually charge for that. So you can do a group visit, charge, and insurance will pay for it if they have a diagnosis like metabolic syndrome or diabetes or something like that.
Oh, cool. That's very neat. And I think that that's so true because sadly, I would like to say that it only took one person telling me something to maybe make a change, but I can't see that that is definitely not true. And I think if it came from a bunch of people from multiple sources, I think that would have a really a lot larger
And
impact.
you need to give them a tool to help them once you,
Hmm.
and that was where I was failing all those years ago. Was I'd hand them a piece of paper that had a list of healthy foods on it, but nothing about how to cook them or how to make
Mm.
them taste good or that sort of thing. And I mean, it was like just kind of, you could see their eyes glaze over when they looked at it. It was a complete waste of time. On the other hand, if you say, "Gosh, go get some spinach and saute it with a couple of cloves of garlic and a little bit of olive oil for about 3 or 4 minutes until it wilts, and then put some drained white beans with it and put it on a plate," they can actually do that. They can see how to do that.
Absolutely. Well, I think that's kind of perfect then with the teaching kitchen collective that you were talking about, just giving like even if people don't have a connection to a teaching kitchen, like they can tell their patients, here, go to this website. They have recipes, a few
Right.
videos, and these are things that we actually recommend that you do. This is not because that's been one of my things when I was first starting to cook. I was like, I want to eat healthy. I don't know how to. I think the worst thing you can do is Google how to eat healthy because you get
Oh
60
yeah.
results about all these different diets telling me to cut out everything from my diet. And I was just like, I don't know what to do. And so I think kind of condensing everything to say, this is something that I'm going to recommend as your doctor that
Hmm.
is proven well, good recipes that you can trust. I think that's really important and really great.
And there are some beginning to be some cookbooks of healthy cooking that are actually very good based on plant forward cooking, and the recipes are very tasty. There's one from UT Southwestern. Wesley McWhorter is the chef and RD that wrote that cookbook, and it's, oh, can't think of the name of the book, but we've got in the teaching kitchen, I've got copies of some of those books. And I do tell patients about those books or show them the books when they're in
Hmm.
the office, and they're available on Amazon, and But you do want to. I always want to use uh, information that has science behind it, so it's evidence based and proven to work and that sort of thing. Because you're right, if you go on the internet, you're going to find 1,000 things that claim to make you live to be 1,000, or make you run faster than any guy on the earth or whatever, and it's never true. And half the time it's bad advice that actually makes you
Absolutely.
unhealthy.
Absolutely. So I think that is one thing that could be super impactful, is to have your doctor that you're kind of, you have your faith in and your trust in, that is looking after your best health, to have them say this is a resource and this is a diet that I would myself eat, and I'm not just going to tell you to go eat. I think that's really cool. um, Kind of a kickback to the beginning of this podcast, so we were talking about almost the lack of, I know we talk about all the biochemical pathways of digestion and how that works, but actual like nutritional advice to to medical students, is pretty much nil. I know that we have a little bit, but not a whole lot. I wanted to ask, what do you think the future role of teaching kitchens could be within medical education, if you could see that bridging into education for medical students, or what do you think?
Yeah, I think I am almost certain that in 5 years or maybe less, uh, medical education will involve a lot more nutrition and a lot more lifestyle, exercise, etc. Uh, because the science is definitely there. I mean, it's as effective or more effective than a lot of the drugs we use. It's just the drug companies have a whole lot of money to promote their drugs, and they're good. I mean, the drugs are good, but um, the science around nutrition and exercise and stress management and good social connections, healthy lifestyles is very compelling. And unfortunately, we're not teaching that to either med students or residents or patients very well currently, but we're getting better at it. And I'm pretty confident that within the next 5 years, med students will get a lot more nutritional information. The science is overwhelming, and I think the biggest uh, what's the word, frontier in health is the gut and the microbiome. It's amazing what the microbiome and brain do together and for each other, and what we eat and how we exercise and how we live affects the microbiome dramatically, and then it affects how we feel and whether or not we get sick and all sorts of other things. That science is just really at the very beginning of its blossoming. So I think we won't be able to ignore it in the future.
Absolutely. No, I I hope you're right. I really do. I think that that's really.
It's coming. It's coming. I mean, the new med school, the new USA Med School, has a teaching kitchen in the med school. So you were just 2 years too early.
I know. Hopefully, I'm not still here in 2 years.
Yeah. But you can come back.
That's right. That's right. That's right. Well, I guess going off that, I want to ask, you may or may not, I wanted to say, have you had like any success stories or anything where you've had a patient adopt um, new like ways of cooking and seen, I don't know, maybe like how their health improved, if their medications changed at all? You might, I don't know. I'm just,
Yeah, I've got really a lot of patients uh, who I've seen for a long time who probably heard me say, "Hey, we really need to pay attention to your lifestyle. Maybe either you're eating or you're not exercising, or both." Uh, for many years, and made very few changes. But
Mhm.
once we got started doing a little bit better coaching and involved dietitians with that coaching as well, I've got several patients who actually had type 2 diabetes who are controlled off medication and had significant weight loss, feel better. They definitely feel better and are maybe running or walking for an hour a day. And when they were walking or running almost zero before.
Hmm.
So they just feel tremendously better. And they don't want all those bad foods that they used to think they wanted. They don't like sodas anymore. They don't like donuts anymore because they just, it's not that anybody ever told them they couldn't eat them
Mhm.
because we try to avoid saying anything's forbidden. It's
Mhm.
really just that this is better than that. And once you, I mean, like, I know I can eat donuts, but I don't want donuts. I mean, I just, because I know what they feel like after I eat them. And I know what I feel like after I eat them. So, and I love peanut M&Ms, but I rarely eat them just because I don't.
Oh,
Because
I
I know there are things I'd rather eat, you know.
absolutely, absolutely. I know. I think that that is really interesting. Kind of like you were saying, the snowball effect of once you actually make one change in your life, like eating healthy, I think it is a lot easier and it kind of makes you feel better. You do start to find the drive to maybe start exercising a little more
Right, right.
and it is just a rapid kind of lifestyle change in that department.
You know, it's funny. There's a one of your co-students is has just written a paper on some old data from our one of our first classes we taught about 6 or 7 years ago, I guess, uh, and it was with cancer survivors at the Mitchell Cancer Center, and we had two cohorts who we did not talk about exercise at all. We only talked about healthy nutrition.
Hmm.
One group had, I think, 6 classes, and the other group had 4 classes. The second group was during COVID and was on Zoom. But we did ask questions about exercise pre and post. And 50% of the participants increased their exercise without anybody saying a word about that. So it's pretty amazing
Oh,
uh,
yes.
that we were doing a nutrition course, but got a benefit in exercise.
Wow. That is very interesting. And
Mhm.
I mean, that's pretty great results too, right there. That's
It
awesome.
was, yeah.
That's very incredible. Um, well, that's kind of all the questions I have. I guess I will turn it over and say, do you have any other piece of advice that you'd want to give anybody, give any students maybe coming into the medical field or anything, just about how to use nutrition? I don't know.
I think it's always think it's good for us to live the life we're recommending to other people. So I do think it's great for all of us in medicine, nurses, doctors, students, to do what we're asking them to do. And it pays off for us as well. I mean, gosh, my stress levels have been much better since I've exercised regularly and eaten regularly. That's at least partly related to those.
Hmm.
And I feel better. I probably think better, despite my age. uh,
No.
and the that's good for everybody. And my patients know I walk. They see me exercise. They know I don't eat donuts because they don't see me eat donuts. And I think that goes a long way toward helping as well. And I know it helps me, which is why I do it. So
Absolutely.
that, yeah, I think that's a living what we preach is important.
Absolutely. And I feel like that plays a lot pretty heavily into your patient physician relationship. I mean, to see your doctor actually doing the things that they're telling you to do, I think that that's really powerful. And I think that's really special. Um, Well, Dr. Israel, I just want to say thank you so much again for taking time out of your day, coming on and doing
Thank you, Ben.
class with me today. I just think we're really lucky that we have physicians like you who are willing to come talk about their passion and share advice with others. So just thank you so much. And
Thank you, Ben. All
absolutely.
right. Good talking to you.
All righty. Good talk.
See you.
See ya. Bye bye bye.
Bye bye.